All right, so we did get a hold of Dr. Judy Mikovits. She joins us now on the Blaze. Dr. Mikovits, welcome.
Good morning. Thank you.
So we have seen your video, Plandemic, and I'm really fascinated by it. There's so much information and misinformation. First of all, let me ask you this: you have worked with Dr. Tony Fauci in the past, right?
I have not worked for him. I've worked in collaborative efforts or been paid by NIAID.
Okay.
So my bosses have worked directly with him. Yes, he's quite a bit older than I am.
Yes.
So,
okay.
I was in laboratories working directly with Tony Fauci on projects, mostly with HIV, and then funded when I had directing labs.
Okay, you contend that Tony Fauci delayed some of the treatments for HIV/AIDS?
Yes, delayed treatments, delayed diagnostics, participated in a lot of.
Why would he do that? Why would he do that?
Well, targeting it towards things for which they had patents and targeting it towards biases that, I didn't know at the time or didn't appreciate at the time.
Okay.
But I appreciate that.
So Dr. Fauci, are you alleging that he has patents that he was trying to benefit from then?
Correct.
And that's why he delayed other treatments?
Correct.
Wow, that is really, that's quite a claim, and pretty astounding. And this is the guy that we're listening to all these years later. How is it that more people aren't aware of this or don't know about it?
Well, we've listened to this for 35, 40 years. He's got quite a bit of power. Mm-hmm. He controls what I've learned the other day. He controls $6 billion of funding through NIAID and other sources. That's an awful lot of power as with respect to publications, who publishes in what journals. So the system is totally broken, and the system is totally broken, and it's been broken for a long time.
We're talking with Dr. Judy Mikovits. Her new book is called Plague of Corruption. All right, well, let's talk about COVID-19. You have some interesting assertions where that originated as well, right? You're not claiming necessarily that it was created in a lab, but it was manipulated in a lab?
Yeah, clearly clearly the data show. In fact, the 2015 Nature Med paper, these aren't my assertions. These are just looking at published paper and looking at the data. Mm-hmm. So the 2015 paper discussing the emergence of the SARS-CoV-2 virus shows that from the investigators in Wuhan, in collaboration with the investigators in North Carolina, and in collaboration with investigators, I believe, at Harvard and Switzerland on that paper, the paper says they obtained a cell line called Vero E6. That's monkey. Those are monkey kidney cells from Fort Detrick, USAMRIID, the Biosafety Level 4 in Frederick, Maryland. The studies was funded by grants from the NIAID, that's under the control of Tony Fauci, as you know, mm-hmm. And they sent the samples to the Wuhan, China lab, the cell line to the Wuhan, China lab, where they grew the coronaviruses in cell lines. And that's by definition not natural evolution of viruses. That's by definition lab generation of viruses. And you can easily pick up sequences and have recombination go along with the other viruses in that cell line, which include HIV viruses. They're simian, they're monkey viruses. It's called SIV, which include gamma retroviruses. There's a number of monkey viruses, the gamma retroviruses, that's the same family as the mouse viruses that we found in people, includes coronaviruses. So you can have a lot going on with recombination there. And that's not natural evolution. That's
And how long would the natural evolution of this virus take, where it would jump from animals to humans naturally?
Going directly from animals to humans, could take evolutionarily up to 800 years, because that's not how it usually works. Usually it'll go nosocomial through another small animal, and that's what cell lines are. But these cell lines, they're continuously growing. They grow out in a laboratory. You feed them. You can grow up liters and liters, hundreds of liters, and that's how vaccines are made, in these animal tissues, animal cell lines that are continuously growing. So in natural evolution, you have to pass from another animal and see they kill cells, or they can't infect them at all, or these viruses will simply kill the cells. And a virus doesn't want to kill its host. It needs to have replicating cells, to live in. And it needs a place to live. It can't grow in the air, float through the air. That's why all of these measures have nothing to do with public health and the spread of a coronavirus. That's not how they spread.